We have U.S. Representative Dan Kildee with us today, so we want to welcome him. I am excited that I have the privilege to be your moderator today as a co-director of the Healthy Flint Research Coordinator Center. So again, on behalf of the center, we'd like to welcome you to this 44th week of partnerships, bringing to you here in our community the community webinar coronavirus. Just to remind you, this coronavirus webinar was set up to help us understand, even though in a global pandemic, we had some local concerns that we had to address. So I want to especially thank all of our local partners that have been on with us. You can see the banner there. Thank you so much, particularly the Genesee County Health Department, the city of Flint, even at our governor's office. The governor has sent representative to us. Our state health department has been here. And so many of you community partners have been instrumental in helping us get the word out to our community. I want to just take a real quick moment to introduce something else that's been stood up in the last few weeks as a result of what we've seen happening with the pandemic. The Genesee County Health Department, along with the Flint Center for Health Equity Solutions, has developed a health equity brief for Genesee County and Flint. This health equity brief gives us current trends that are relevant to us, gives us case counts, helping us to understand what's going on specifically here. And as you can see on the screen, sometimes we don't have the data ready for us. It's delayed a couple of days, but if you stay with us and keep getting these, looking forward to these briefs, we'll have information available to you. 17,325 vaccines have been distributed across Genesee County, and there is more to come on that. We'll give you that information later. But Congressman Kildee, we wanted you to know that this was stood up in our community so we can keep track of what's happening from an equity perspective, from the distributions perspective, and perhaps as we move forward, this will be helpful to you. We want to give a shout out to Mary Catherine, who has been instrumental behind the scenes making this available to us. And if you want more information and you want to sign up for this brief on a weekly basis, please send your email address or contact Mary Catherine Crawford at crawfordf457@msu.edu. And because I know some of you are listening by phone, it's Crawford, CRAWF 457@msu.edu. This is brought to you on behalf of the Flint Center for Health Equity Solutions. So excited to be a part of that work as well, along with the Genesee County Health Department. Now, for what you've all been waiting for, U.S. Representative Congressman Dan Kildee. Dan, it's so exciting to see your face actually. And I want you to know one of the big questions our community has is, so how are you?
Well, that's a good question. I'm better every day. I'm okay. Maybe I'll just take a couple minutes and tell you a little bit about that, but also about the path forward, because it directly relates to the work that you all have dedicated yourselves to. So thanks, Yvonne, for including me, and thank you to all of you for what you do every day. So we all had this great idea that 2021 was going to be a lot better than 2020. It hasn't started out so well for me, but I think we still have a chance to make it a great year. What happened last week? It was just something beyond comprehension. I was in the Capitol. I was actually on the floor of the House preparing to defend against the challenge to the Michigan electors when this whole thing happened. And unfortunately, I was one of a handful of members of Congress that were in a particular spot where we couldn't get out. And so, when that mob showed up, we were kind of stuck there with just a handful of Capitol police officers that had, they had their handguns. They didn't have anything more significant than that. And there were quite literally hundreds and hundreds of people on the other side of the doors trying to get to us. And I don't want to go into it too deeply, but you can read, there's some, coverage now that's just coming out, lots of news stories about what the intent of that mob was regarding those of us who were in a position where they could have gotten a hold of us. Thankfully, we were able to escape when a brief moment occurred, when one of the hallways was cleared by a tactical unit and we were able to get out. And I spent about 4.5 hours hunkered down after that 45 minutes or so, that I was really in a bad spot. But here's the thing. What they were trying to do was to prevent us from following the Constitution and accepting the electoral votes that had been sent from the 50 states around the country. They wanted to stop that process. They wanted to disrupt our democracy. This was an insurrection against the country. And I'm not going to take long, so I'd like to leave whatever time you have for questions, but they didn't succeed. We prevailed. We certified the election. I was going to say that night, but I actually got back to my place in Washington about 4:30 in the morning after we were able to get that done. The problem, of course, and I won't dwell on this, but I think it's important to say this is an important moment in history, and I want to make sure to share it with you. The underlying problem, the underlying issue here, of course, it was that a mob stormed the Capitol and killed people and intended to kill me, and almost did. And of course, it's at least a fact to those of us who believe in facts that it was whipped up by the President of the United States himself, not just by what he did in the hours leading up to the attack, but I think much more nefarious, the fact that he, and unfortunately, a lot of my colleagues, whom I can never look at the same, have participated in a big lie that unfortunately some people have chosen to believe, the lie that somehow this election was taken away from Donald Trump. The facts are that he lost the election. People win elections, people lose elections. I've been through both. In our system, we accept the outcome, even when we don't like it. I attended Donald Trump's inauguration. All you need to do is look at the CNN archive to see the look on my face. And it's not a happy one, but I was there. I sat where he gave his State of the Union because he's the President of the United States. And so I think we have to make sure we don't fall into a trap of believing, well, on one side you have this group and on the other side you have that group, and we all need to find a way to come together. We come together, we reconcile when there's an acceptance of truth. You can't have reconciliation without truth. Otherwise, it perpetuates the lie. You can't have a false, counterfeit reconciliation with people who still cling to a fantasy that is just pure concoction. Mm-hmm. So that's why we voted to impeach the president. In 5 days, we turned the page. And Joe Biden and Kamala Harris will be sworn in. I'll be there. It's going to be like an armed camp, but I'm going to be there. And so now we work with this new administration to try to get back to where we were just a couple months ago and focus on the work that you all are focused on. And that is getting this virus crushed, and especially focusing on educating the population to distribute the vaccine. We have administered, as has been said, in this state, hundreds of thousands of vaccines. We got a long way to go, and it'll make a difference to have a federal partner completely committed. I was just on a Zoom yesterday with President-elect Biden's two of his top economic domestic policy advisors, Brian Deese and Jeff Zients. The plan that the Biden administration has just announced is to aggressively move to vaccinate 100 million people in the first 100 days of his administration. So we're working with, and I know Gary's on the call, we're working very closely with the governor's office, with our other federal partners, now with our county partners, to get that part of this new initiative, this new administration underway. Another important aspect of it, of course, is the whole COVID relief package. We did come together just, at the end of the year with a $1 trillion emergency relief package that will help us get through the next couple of months. It includes support for vaccination. It supports a strong testing and tracing strategy. And it's important that we keep in mind, just because we're now logistically really focusing on how to get the vaccination in place, we still need to have a very strong testing, tracing, isolation regime in place. We've got a long way to go. So, what Vice President soon to be President Biden um, has initiated, I guess, announced, and this is the purpose of my call, is to build on what we've already done in this next piece of legislation. What we've already done included $25 billion for that testing and tracing, another round of $600 payments, which we need to, in the legislation that we're taking up, we'll add another $1,400 to that. We extended unemployment, which we address. We added more money for rental assistance. We added more money for small businesses. We actually included other provisions like continued funding for the Flint Registry. That was a piece that I was able to, through my work with the speaker, get included in the legislation. So as I mentioned on Thursday, the soon-to-be President Biden announced the next relief package, an additional $20 billion in funding to help state and local governments deploy the vaccine by supporting community vaccination centers, mobile vaccination units, creating lots and lots of public health jobs. I mean, what we know is, and this is included in our plan, deploying, 100,000 or more new public health professionals to get out there and help get this done. It's the production of the vaccine. It's the material required in order to get the vaccine distributed, but it's mostly the capacity of our state and especially local partners to be able to manage the throughput of that vaccine. The vaccine does nothing unless it gets into the arms of people. And of course, as I mentioned, one aspect of that new plan will be to provide additional payments to Americans. This is really a critical part of what we're trying to do, supporting local business and supporting families. So I know I've gone on a little bit, but there's a lot going on.
And that's fine, because what you've done is you've set a really good platform, and we thank you, because so many were concerned about you and the work. We know you've done such great work for us here and standing on behalf of the city of Flint. And so we all struggle with this fact. 2020 was a challenging year, with the COVID, then the racial unrest, and that's not over yet. And now we layer it with your experience last week. And many are grappling with, so what do we do in the citizens? We're here in our local communities. What do we do? What kind of support can we lend to this work?
Well, I mean, I think what you're doing, we have to accept the fact that at the federal level, and that really goes to the state, we need resources. The local organizations, we can stand up a lot of this, but we need resources. We need more people to do the work, more money to support the efforts that are going on right now. So, we've got to, this is going to take a while. So, I don't know if you have specific areas that you want to work on. I know Chris Flores, who's joining the call. We have our district staff that will work with any of the organizations, but I also have a whole team in Washington, including one person completely dedicated to healthcare and health policy, Maggie Herman, and we're just happy to help in any way we can.
I think that's important that our community recognizes that you have an office here that we can connect and communicate with anytime, and then you are open to having local residents connect with your staff in Washington. And so there's an appropriate way to get that done, but we're happy to know that you have that accessibility for us. So there are a few questions that we have in our queue today, and one of them, and we talk about this relief package that you mentioned. One of the questions is what is being considered for those in our community, our residents who are undocumented?
Right. And so this is something that we address directly in the package that soon to be President Biden will bring to us, and that we will hopefully vote on very soon. And it is to make sure that we are supplying all the health support, including vaccination, testing, tracing, et cetera, regardless of anyone's status. There will be, of the many changes that you are going to see as of 12 noon on January 20, when we have a new president, a lot of policy requires the Congress to act. But a lot of policy, especially when it comes to the way we view people in our community who are undocumented. A lot of that is at the discretion of the administration. And what we've seen in the last 4 years is that discretion has been used as a weapon against people who come to this country, or particularly those who came as a child, people who come here for the same reason everybody comes here, and that is to find a better path for their family. And so that aspiration is something that we ought to celebrate. People who want to be here, we ought to celebrate that. And so we'll have an administration now, thankfully, that embraces that notion. But the first iteration of that will be that there will be no distinction between individuals when they have getting access to any of the coronavirus health support based on their status. And that's a really important question, and it's, I think, a really important change that we will see.
Yeah. Also, in the stimulus package, you mentioned something about the evictions and tenants. This is a question: can tenants be evicted from their homes during this time?
So our legislation will extend the moratorium on eviction, and importantly, add billions and billions of dollars to the tenant relief, because it's pretty difficult, obviously, just in terms of the basic economics. We don't want people evicted, but we know that many of the landlords that we're talking about are small business people.
Yeah.
And even if they're not small business people, we have to make sure that we're creating the kind of support that it takes for people who've lost their job, don't have financial resources to be able to pay their bills. And if they can't pay their bills, not face eviction as a result. So we're taking this on in a number of different ways. One, we're increasing the unemployment and extending the unemployment benefit, the additional unemployment benefit, until September, which we think by then perhaps we're through this. It'll be the state unemployment, whatever the weekly unemployment benefit is, plus a $400 federal supplement. We will have another $1,400 stimulus payment on top of the $600 payment, which allows some folks to kind of get caught up and also contribute to demand in the economy. We will then have a moratorium on evictions, but we will have additional financial resources available through the agencies right here at home that are providing that relief. Just run out of the money. And so what we want to do is, recapitalize those funds so that they have plenty of resources. So if an individual is unable to pay their rent, that rent will get paid, because what we don't want to see is that by implementing a moratorium, that we actually see some of these tenants get stuck in housing that continues to degrade because the owner of the property has no revenue to support what they need to do to keep the property up. And let's face it, those small business owners might be landlords. Some are great, some are not so great, some are okay. But either way, they're small businesses that we don't want to see fail. And so that's why we included this sort of multi-prong approach to it.
Yeah. So Congress, we know that these are not simple issues, right? And there's so many different layers of it. And we appreciate you being here to answer questions. So I want to just take a moment to say to our listeners, if you have questions, we have a few more minutes with the Congressman. Please put your questions in the queue and we'll bring them forward. You talked a little bit about things that our community needs. And sometimes we stand up efforts, and because there isn't the support congressionally, money doesn't flow, and some of those efforts go by the wayside. But I want to just ask you to talk to us a little bit about one of the initiatives that we had stood up here as it related to the water crisis, our Flint Registry, and what you were able to do to get some resources to continue to support that.
Yes, thank you. So as you may recall, back in late 2016, it was actually the last piece of legislation that my friend Barack Obama signed before he left the White House. We were able to get the Flint relief package through the House. And that was difficult because I was in the minority then, but we were able to get it done. And Senators Stabenow and Peters were able to get it through the Senate. It provided a lot of help. But one of the things it did is it stood up the Flint Registry, which, as we know, is the mechanism to provide direct support, health support to those people affected, and access to other aspects of our support. Well, that funding for the registry in that first piece of legislation, just because the way Congress does something, it was only for 5 years. And
Yes.
so we were able to get in this last bill, and that was about to expire in July of 2021, July. So we were able to get another year of funding because we were kind of doing it right at the end of the year in the emergency spending bill. And I have a commitment from Speaker Pelosi, and of course now with the majority in the Senate, because Kamala Harris is going to break the tie, Senator Stabenow and Senator Peters we're working together to make sure that we get long-term funding for the Flint Registry. And we were able to get a modest increase in what the registry will actually receive by making sure that the entire amount, minus whatever the CDC takes just for a little bit of its admin, goes directly to support the registry. So it's a step in the right direction.
Thank you. So we want to be sure that our listeners know this is still work that's being done in Flint. We know as a result of the water crisis, we still have a long way to go. The long-term implications are still not clear to us. So the goal is that we're able to put something in place that will help us monitor how things are going, how people are doing. Particularly, there's a focus on children, but we know everyone in our community was affected by that. I will call it fateful situation. So in light of that, we had some news yesterday. I wondered, Congressman, if you have a reflection on the news we heard yesterday with respect to the indictments.
Sure. And I think this is one of those cases where we're reminded that justice for the people of Flint comes in a lot of different forms. It will come, with the funding for the registry. It comes with replacing the pipes and improving the infrastructure. It comes with, and I know this is a controversial subject, and, it comes with the financial settlement. Not all claims have been settled, but it comes with people being compensated. It also comes in the form of individuals who are responsible for what happened having to answer to a court of law. And that's what was announced yesterday. I know it's taken a long time. I think we do have to remind ourselves, and those of us who have circles that we can affect, that it was under a previous administration and a previous prosecution team that a whole series of charges were levied. Then when the new attorney general came in and appointed her team, they took a look at those charges and found what many of us suspected, that it was sort of a botched prosecution. It was mostly for show, and there was a lot of evidence that was not fully analyzed. And so they committed to do it again and go through it all. So now, a year and a half after they initiated, these charges come down. I will say this: I never prejudge the outcome of a criminal investigation, and I never prejudge the outcome of a criminal case. It's just a philosophy that I adopted many, many years ago when I became a public official. I think in order for the system to have integrity, it's important that people who help make the laws that are being enforced not also substitute ourselves into the position of a judge or jury. My main concern, and this is what I told the Attorney General when she sought my counsel in moving forward on this, I was very simple in my message to her. Follow the facts, wherever they lead you, and make charges that you believe are supported by those facts, whomever that might involve. And I think that's what she's done.
Yeah, I think she took your advice well, because when I heard her make a statement about what she was doing, those are the exact words that she said. We're going to follow the facts, and wherever the facts lead, that's the decisions that will be made. So, Congressman, just a couple of more things. We talk overall about democracy. And as related to the water crisis, specifically in the state of Michigan, with the emergency manager law, and for us here, we have many, many advocates who are on the front of saying that our democracy was compromised by the way that happened. And yet we see, as a result of even our presidential election, where more people saw the value of our democracy because we had more people vote in this election than ever in the history of the United States of America. What would you say to us as a community who has gone through all of these difficulties, having faced our voices being, in a word, shut down or overturned, and now here we are? What would you say to the citizens of this community about the importance of their voice?
Well, I think this shows this election, the 2016 election, And frankly, if you want to think about the subject that we were just discussing, the water crisis, the 2010 election, has a consequence. There's no two ways about it. What we, and I know this is not a political conversation in some ways, but it's about civics. And I think it's impossible to ignore the fact that that the approach of the current president, who's leaving office in, less than 5 days, actually 5 days, 4 days, 4 days, 23 hours and 34 minutes from now.
The countdown, right?
Not that I'm paying attention to it. But that election had a consequence. It had a consequence for children who were being torn away from their parents. It had a consequence for people of faiths that the president decided to target. If you happen to be a member of the Muslim community, you know what consequence it had. It has had all sorts of consequences. It had a consequence for me in the sense that just a few days ago, I was wondering if I was going to live or die as a mob whipped up by this president tried to overtake our democracy. There are a lot of consequences. The decisions that are made by people in positions of authority are only made if we allow them to. And what we've seen is that when we participate, the results are different. And so, and I'll say one more thing here, because it's a really important question. I think it's legitimate for people in our community to have serious doubts about whether the system works for them. Mm-hmm. Because they've had their faith tested. And in fact, government has failed the people of Flint. Every level of government failed the people of Flint when you look at the water crisis. The problem, of course, is that if we allow that loss of faith in the institutions of our society to cause people to step back from participation, it becomes a self-fulfilling prophecy, because the people who participate have their views reflected in the people who make the decisions. And if we decide that because of our disgust with the previous decisions made that were not in our interest, that we're just going to walk away from the process entirely, the chance of another Flint crisis happening go up. Being a citizen in a democracy is a full-time job.
Yes.
It's not a spectator sport, pick your analogy. It's a full-time job, and it's not easy. But what we know in Flint is that it's not made easier if we take ourselves out of the conversation. It's made worse.
Yeah, thank you. And the fact that the Healthy Flint Research Coordinating Center now has been 44 weeks with over 45 partners working together to bring information to our community, both the Flint community particularly, but Genesee County, is a testament of the power of that collective voice. And so we want to thank you for joining us in sharing your perspective and being a part of this whole conversation, because it cannot happen in silos. We really have to work together. So as we're moving forward with this effort in the next few weeks, and particularly focusing on how we're going to deal with this pandemic, we want to make it clear that you, as a partner, along with the City of Flint, the Chief Health Advisor, Dr. Reynolds, the Genesee County Health Department, and our university partners working together, along with all the voices of the community, organizations, and individuals. It is all of us that'll make the difference here. And so we want to encourage our listeners, over 100 here, plus all of those that are listening by Facebook. And if you join us by Facebook, don't give up. Continue to use these mechanisms. So as we close this segment, I know you told us you had to go on to something else at 12:30, but I just want to give you, I love Lawrence O'Donnell. So he says, the last word. So we're going to give you the last word, Reverend Kildee. And again, just let us say thank you.
Thank you so much. I really consider it a privilege and an honor to to represent our broader community. But, you know, I'll be honest with you. I'm a Flint kid, born and raised in Flint. Flint's my home, my hometown. And I'm proud of my community. We've been through a lot, and we've got this sort of grit and resilience. We don't hide our head in the sand about the troubles we have, but we've got this willingness to continue to fight and struggle and succeed. And I hope that some of that translates to the work that I do in Washington. There's not a member of Congress, when they see me, we all know just a little bit about one another. Some of us are really close, but there are 435 members of Congress. I'll guarantee you every one of them knows I'm from Flint. Every time I see them, they say, "Hey, Flint." They know I'm from. We should be proud of our community. I am. So I just want to tell you that, and give you my gratitude for allowing me to be a part of this discussion. So thank you.
You're welcome. So again, let me thank you on behalf of all the citizens of Flint, and I just take that liberty as a moderator today. And our partnership, we thank you, and the door is open anytime that you have some important information that you'd like to share with us. I want to thank your staff for helping us to arrange your schedule today. And again, we're going to go right into our policy brief. So I hope that some of your staff can stay on and really get a sense of this work that's being done here, because as you know, we have been able to at least look at how we've turned the tide on the inequities of the number of deaths of African Americans in Flint, Genesee County as it relates to this coronavirus. There's a lot going on. There's more data that we need, but I think it might be helpful, and we'd like to offer our support for you in any way that we can to bring this information forward that you can use to help you, but ultimately will help us. So if everybody could wave at you and put a thumbs up in the queue, they do that. So let me again, thank you.
Thank you so much.
All right. So we're going to shift and have Dr. Deborah Verholden come on and talk to us about this policy brief that, again, is a partnership between the Genesee County Health Department. They've got all the data. The Michigan State University has been able to help them pull that together to come forward with this policy brief, spearheaded by Dr. Deborah, but with great support from Mary Catherine. So Dr. Deborah.
Yeah, great. So you gave the quick synopsis, so I'm gonna roll through it real quick. And how awesome was that to hear right out of the mouth of Congressman Kildee, sort of what's going on and what that experience was like. I'm really grateful that he joined us. Yvonne, thanks for helping to usher this along and really get us the best, most credible messengers across a range of things. So just salute you, partner. So this COVID health equity brief, we started off originally, Mary Catherine said, I got this thing down in my soul, Mary Catherine, turn your camera on. She said, I got it in my soul. She wants to work with policymakers. She's got her master's in public health from GW, brought that back to Flint. I'm hoping we can have her for a couple of years before she runs off to become a doctor of public health. And she works with our fabulous team at the Genesee County Health Department and Rick Sadler and his team at Michigan State University through our Flint Center for Health Equity Solutions. So the good news is that the case counts remain steady in Flint and Genesee County. We saw a steady increase over the last 5 to 6 weeks in the county and 4 to 5 weeks in the city of Flint. And the rate of drop off has started to tail a little bit, and I'll show you in the next slide. But an issue that we do have is we've done better in Genesee County and Flint and in the state of Michigan than a lot of places have done across the country. But we still do have this issue of unknown race. People are collecting the COVID tests and the COVID samples and aren't attending to some of these things. So then the data folks and the health department and Mihan and others are having to go back in and fill that stuff in after the fact. So we are being very careful and cautious and cautiously optimistic about talking about where we are with the racial disparities, because we're seeing that we got to have that data so we can say it with certainty. But what you can see from this is the rates are continuing to go down. You'll see it started to sort of level off in January, but notice where we are now from where we were. We are at about a third of the rate that we were the first week of December when you compare that to the first week of January. And that is true for both Genesee County and for Flint. Okay, next thing. And then I'm gonna give Mary Catherine the last minute or two. A lot of people have had a lot of questions about comparison of COVID vaccines. You've heard about the Pfizer vaccine, the Moderna vaccine. I'm not going to go through that with people now. People have questions, put them up in the Q&A. We'll be happy to answer them. If you sign up for the policy brief, all of this is there. The whole point is we want to give people, not just policymakers, but also our citizens, some hot off the press information to help them make decisions on how to navigate COVID. Now that the vaccine is available, you'll notice what Mary Catherine has done this week is put in a lot of good resources for people about the COVID vaccine. I trust that Suzanne will give some more information on that. So I'm gonna just skip through all the way down to the end there. Next slide, please. The recommendations that we have for policymakers: we need a clear coordinated vaccine messaging campaign and distribution strategy. We've heard a lot about people having to call the health department or keep trying to register on the website, which updates every Monday at 5. You know, we're working on smoothing out some of the kinks with that. And it's important that our policymakers know that we need, and obviously Congressman Kildee said it, those resources locally to be able to do that. And then we also need to make sure that we've got a clear plan in place to make sure that everybody gets the first dose, gets the second dose. And we've got to prioritize funding at the local level to be able to get the vaccine out, get additional sites, get people recruited who can help get it, as we say, into people's arms, and also improve distribution. And then more importantly, and we're really hoping that this improves after January 20th, we got to work across the aisle to ensure public health and good science are actually driving these decisions. So for follow-up, Mary Catherine, who do they contact? What do they do if they want to make sure that they get this in their inbox?
Yeah, so if they want to get this in their inbox, go ahead and subscribe to the link that I put in the chat. I put the link in. All you have to do is put your name and email. If you wouldn't mind, please select an affiliation so that we have the best data and make sure it gets to where it needs to go. Or you can actually email me directly from the brief if you have questions, comments, or feedback. You can email me directly. I will put that in the chat, and subscribe anyone who needs to be subscribed.
You have to say it. Some people are on by phone and they can't see, yes. So we have to give it to them verbally.
Yes, if you are joining by phone, my email, crawf457@msu.edu, and you can reach me. I will respond.
Okay, awesome. All right, I'm handing it back to Yvonne.
Thank you, Mary Catherine and Dr. Deborah. This has been exciting. A lot of people have really learned a lot from that, but your input, when you read the brief, if you have some comments, please put them in there. So Gary Jones is with us today, and Gary used to work for Congressman Kildee, so I know that was a nice little reunion moment. So Gary, we are so happy that the governor allows you to come and talk to us every week, unless you have that much needed R&R day. So give us the updates from the governor's office for today.
Yeah, thank you, Yvonne. Actually, I had to put on the black vest just to match the congressman here. So I tried to keep with the congressman swagger. So just a couple stats before I get into the announcement. So total confirmed COVID-19 cases now are statewide 531,004. Total COVID-19 related deaths, we recently surpassed the 13,000 mark at 13,672. And number of vaccine doses administered now 368,844. Also recently, House Appropriations Chair Thomas Albert said that the governor must take more steps toward reopening the economy before the legislature can have meaningful conversations about the next steps in allocating federal COVID relief funds. So he's willing to hold Michigan tax dollars for COVID testing, vaccine distribution, education, keeping people in their homes, childcare, and feeding hungry kids, which we believe is both reckless and dangerous, especially with the new variant of the virus in the United States that actually spreads faster. The governor has rightfully made it very clear that she's not going to negotiate away Michiganders' public health. This is not a game. It's a deadly pandemic that has killed more than 13,000 people in our state. We feel the Republican legislative leadership needs to get serious. They must end their partisan games and actually begin to work with Governor Whitmer to get this funding through. And just to give some background specifically on the federal COVID funding that's at stake, the state of Michigan is posed to receive over $111 million in vaccine funding from the federal bill and over $565 million to support testing, tracing, and COVID mitigation efforts. The bill includes over $650 million to address eviction diversion and rental assistance needs, and millions to deploy more broadband to help our students learn and businesses recover from the economic impact they faced during the pandemic. It also includes roughly $125 million in emergency education relief dollars to help our students and schools recover, and emergency child care funds that close to $287 million. Also recently, the United States Health and Human Services granted Governor Whitmer her request to release vaccines being held back by the Trump administration. The U.S. Department of Health and Human Services announced that they will grant the governor and 8 other governors' requests and release the millions of doses of the safe and effective COVID-19 vaccine currently being held back. HHS also announced that they will follow Michigan's lead, recommending that states open up vaccinations to Americans 65 and up, a move that Governor Whitmer announced last week. Also, the governor requested authorization to directly purchase up to 100,000 doses of the COVID vaccine for the state of Michigan. So the governor sent a letter to Health and Human Services Secretary Alex Czar requesting permission to directly purchase 100,000 doses of the vaccine for the state. And we also recently made the announcement that the governor is going to deliver her 3rd State of the State address January 27th. So this will be at 7 p.m. and due to the ongoing COVID-19 pandemic, the State of the Address will be held virtually in compliance with both CDC and State of Michigan best practices. Want to add the new website to the mix, michigan.gov/COVID vaccine is the best website for all things pertaining to COVID vaccine updates. And of course, michigan.gov/coronavirus is still the best catch-all website for all things related to COVID-19 in the state.
Okay. Gary, I think we're going to put that website up in the queue, but can you just repeat the COVID website one more time? Because as we get ready for this next little segment on vaccines, that's going to become a hot website. So give us that website one more time.
Yep, it's michigan.gov/COVID vaccine.
Okay, thank you. And we will put that up in the queue. Now, Gary, I so appreciate everything you just said. So I have to bring Suzanne Kupel to the fore right now, because when you talked about the governor's announcement, which I'm happy to hear other governors and even HHS is saying, let's take care 65 years of age or older. But now we got to figure out what the plan is going to be. Because I'm telling you, Monday morning, we got calls. It's January 11th. Where are the vaccines? So Suzanne, let's talk about this a little bit. And please, as she's coming forward, if you've got more questions, please put them in the queue, and our panelists will be answering these questions. So Suzanne, you and I, we've talked about this a lot, and you also mentioned to us about availability, and Congressman mentioned that too, what they're doing at the federal level. But I'd like to give you an opportunity to just start this conversation off for us about vaccines.
So we know that there are many people in our community who are eligible to get a vaccine at this time. The challenge is that we don't have enough vaccine available to get it to everyone who's requesting it at this time. So that is a significant challenge. We have been receiving at the health department Moderna vaccine, but we have entered into a partnership with Hurley and with McLaren to allow us to use their ultra cold storage units so that we can also accept Pfizer vaccine. There's more availability of Pfizer vaccine than there is the Moderna. So we've been able to order more vaccine in our community so that we can get it out. The challenge that we have is that we have a limited amount of vaccine, both Pfizer and Moderna, that we'll be able to utilize. And we have made a request for the vaccine doses that we can get, recognizing now that we can get both Moderna and Pfizer. The state has asked us to make sure that anything that we order, that we can get, and again, that's the challenge, that we make sure that 90% of it gets into the arms of residents in Genesee County, and we are doing that. We are also seeking the assistance of support from our National Guard partners, so we have more capacity to do those immunizations. As you've all heard me say in the last few, since late summer, I've talked about the work that we've done to plan for what are called points of dispensing sites in our community. And we've had the support of 6 school districts in that planning process, along with our wonderful partners in the Sheriff's Department and the Emergency Operations Center, and Jeff Wilson, who's our emergency manager. The Sheriff's Department is also supporting all of these efforts by providing paramedics who are assisting with the immunization process. So we are hoping to increase dramatically over the next weeks and months the amount of vaccine that we can receive in our community so that we can get it to our residents. So we say to you now, we know that there are many people who are eligible for the vaccine, but we do not have enough vaccine available for everyone who would like it at this time. And we are working diligently to make sure that everyone who wants to get a vaccine will be able to. Now, recognize also that there are priority groups, and that's what you were talking about before. And I want to let everyone know they can check the website www.gchd.us, and on our vaccine page, there's a list of what those priority groups are. So we want everyone to be able to know. We may not be able to tell you exactly in an appropriate timetable, but we can tell you in what order people will be vaccinated. And as you know,
Suzanne, right there, right where you are, right there, if I could just ask a question. When you say that there is an opportunity, there is a registration process. Can you talk a little bit about, so people know that even though they may go on your site and put their name in, it doesn't mean you have got a specific date and time, but you are now aware that they're interested in getting the vaccine.
So let me just mention again that there's an order in which we're doing vaccinations. The priority right now is 1B. So that includes senior citizens who are 65 years or older and those essential workers who are critical for making sure our infrastructure is up and running. So our role is to try to get as many people immunized as possible. Every Monday, we'll get a good sense of how much vaccine we're going to get for that week. And from 5 to 6 p.m. on our website, we have a scheduler available where people can go and attempt to schedule an appointment. Now, again, there's limited schedules. We are working on a process right now so that senior citizens can provide information, and our team will contact them and schedule them an appointment. We're also working with senior citizen centers, the VAAA, and we have other partners who are excited to help us make sure that our seniors are able to get access to the information that's necessary to get us, the Genesee County Health Department, their contact information so we can get them a scheduled appointment. Now, the immunizations are being done in different ways. We have some scheduled appointments that are at our Burton location, but we will also have appointments that are available for folks at those pod sites, those points of dispensing sites that we talked about. And each week there may be a different school that might be up and running for those scheduled appointments. And again, limited vaccine available to us, so we're scheduling appointments so we know that there's vaccine for the people who have been scheduled. They can choose to go to one of those sites. So yesterday it was Northwestern High School, and Saturday it will be the Perry Center in Grand Blanc. The sites will differ each week because we want to make sure that we have representation geographically for those that need it, the vaccine, and that they can get access to it. So it's really important to make sure that we're getting the vaccine to all of those. Now, we do want to try to focus in on those that are 80 years old or older because they are the most vulnerable members of that senior group. So those are some of the efforts that we're making right now to get everyone immunized.
So Suzanne, I want to just kind of key in on this a little bit more. So let me ask it this way, because you mentioned the site coming up at the Perry Center on Saturday. For those persons that will be going to the Perry Center on Saturday, are they already identified, or is there an opportunity for people to sign up for Saturday?
I've said to you, and I'll say again, everything we are doing is by appointment because we do not have enough vaccine for everyone. So we are scheduling appointments, and that way we absolutely know that we have the dose of vaccine for the person who comes for that appointment.
Right. So I just want to walk through this again. And so just bear with me now, walk through this again. So the people who are going Saturday have already been contacted. They already have their scheduled time. And so it's not open for somebody today to call and say, I want to get in on Saturday.
Absolutely. That is absolutely correct. In order to get your vaccine, you have to have an appointment.
And so then is that when they go to get that appointment, they need to go on your website, gchd.us, and go on that page. And then that's where they'll fill in their name to say that they're interested in getting in the order for vaccine, to get their vaccine.
Yes, and or to schedule an appointment. Okay. So, and then again, for those seniors who may not have access to the internet or may have some challenges, they can provide the information to their senior center or VAAA, and they are working with us to get that information to our staff at Genesee County Health Department. And we are going to be engaging other partners to help as well, particularly now that we'll have this piece on our website where people can identify themselves as wanting to get vaccine.
Okay. So this is part of a distribution plan because we do have a question in the queue, like who's working on the distribution plan. So this is a part of it. So am I clear in understanding you to say that you've worked with the hospitals to be a part of this distribution process? You've worked with the schools. Is there any other groups that you're working with that are helping to formalize this distribution plan?
So currently the distribution plan is those entities that we've talked about. We know the hospital systems have made all their efforts to get their frontline staff and others that are supportive who are directly exposed to COVID-19 patients. They have also assisted with first responders and then also physicians that treat COVID-19 patients potentially in their offices. And that is the great effort that they have made. Now the health department is working again with the support of our school districts offering their sites for these scheduled appointments. And again, I'll say again, scheduled appointments. You have to have an appointment to show up. So that's currently working. Now, the national level, there are lots of work being done at the national and the state level, working with the large pharmacy chains. So at some point in the near future, hopefully when there's more vaccine supply available, that the local pharmacy chains will also be able to schedule appointments, but recognizing again that there's a priority listing. So that 1B group, which is the 65 and older and essential workers that are necessary to keep our infrastructure afloat, all of those folks will be able to hopefully be able to go other resources as well to get their immunizations. We're not there yet. So we're working on it. There's more plans happening. We have a new administration coming into office. Hopefully they will help expand on some of those efforts.
Thank you, Suzanne. Now, a couple of weeks ago, we talked about this and you shared that sometimes the media gets a hold of information that has not quite disseminated down to the local health department so that they can actually feel free to share some things. But I do know that we have large pharmacy chains who have began calling some of the persons who utilize their pharmacies and offering them an opportunity to register to get a vaccine. So I just wanted us to make a distinction today because the pharmacy chains, because it's been a national announcement now that this is coming and they may be reaching out, but that's a different process than what's happening at the health department. Is that correct?
At this time, that is absolutely correct. The health department is receiving vaccine. Our charge is to get it into the arms of residents of Genesee County. All of the vaccine that the health departments receive is being done through our appointment scheduling process.
Okay, so I want to ask one other quick question, Suzanne, because we've got a couple minutes here. You mentioned it, but I think we may not have heard it clearly. But there are some of the individuals in our community who do not have access to a computer. So can you talk a little bit again about what you're doing to assist those students, those seniors particularly, who do not have access to the computer?
So again, working with the senior centers and with the VAAA and other partners to assist in helping them get appointments. We also want to encourage family and friends to support senior citizens and helping them get those appointments. Now, I know that there have been questions in the queue about appointments, and I really want to make it clear that we find out how much vaccine we're going to get for a particular week on Monday. That is the reason why between 5 and 6 on Monday evenings, we post a schedule that's reflective of how much vaccine dose we're going to receive. And so that's the process we're going through, because we do not know far in advance how much vaccine we're going to receive. Okay. So that's really important for everyone to know that at this time, there are no appointments available, but Monday we will know what we're going to get in the way of vaccine for next week.
Okay. So, sometimes we're so comfortable when we throw out these acronyms, and we've got to close today, but I want to just make sure VAAA, Valley Area Agencies on Aging, VAAA, that's the organization that really focuses in on getting information to our seniors. So the Valley Area Agency on Aging has been engaged with the health department to address the issue with seniors. One other critical point that's being made is if seniors don't have someone who can advocate for them and get this information to them that we're sharing with you, they may not or will not know it. So I'm going to ask you again, those of you that are part of the webinar today, or you're listening to us via YouTube, however you're getting this information today, we're encouraging you to help us be advocates. One of the important reasons for us to have these conversations on a weekly basis is so we can do our best to inform you, so you help us inform others, because it's going to take all of us to ensure that our community is safe, that we're protected, and we can only do that when we have quality information that we can trust and that we feel the comfortable sharing. So I'm going to ask you to please help us. And thank you so much for putting your questions in the queue today. I must say to you that for those of you who are community health workers, please know that you can get CEUs for being a part of these webinars. If you've missed one, you can go back and look at it as well and get the CEUs for it. So let me thank each one of you for your input here, because it's helping us. We're currently looking at getting CEUs for social workers. Please like us on Facebook. This helps us to get the word out. Like us on Facebook, subscribe to our YouTube channel, which is Healthy Flint, and then feel free at any time to email us at info, I-N-F-O, at healthyflint.org, or you can even call us at 810-835-2130, and we do appreciate those calls. We're going to be back here next week for our 45th webinar on coronavirus. It's happening because you are happening, helping us to make it happen. The last thing I want to say is many of us have been challenged by all of these challenges that we face in the last few weeks. So one thing we've got being prepared for you is an exercise to help us all work through how we can handle and deal with these difficult issues. So I want to thank the team that's helped us pull this together. And remember, we'll be looking for you next week for the 45th Healthy Flint Research Coordinating Center Flint Community Corona webinar on coronavirus. Thank you for listening and being a part of this session.